will show up when we're live.
All right. Hello, everybody. We are just getting started and getting underway here and working on the back end to get the slides up and also cast this to Facebook Live. But thanks for everybody joining on Zoom. We're going to let a few more folks join before we get started. All right. I think we've got most folks jumping in on Zoom. And again, we are going to cast this on Facebook Live, and it's being recorded so you can revisit it as there are points that you would like to hear again. But thanks everybody who is joining us today. My name is Julie Babbage, and I am the Executive Director of the Diabetes Patient Advocacy Coalition. And we are going to tell you a little bit more about us in case you haven't joined DPAC in the past, as well as a little bit more just about brown bags in general. If we are getting those slides up, I think right now, perfect timing. Okay. So we have brown bags regularly. These are chances, sort of like a lunch and learn, where we're virtual. Everybody can enjoy this during the lunch hour, whether you're joining us on the East Coast or West Coast, and dive into a topic where we really take our time and try to unpack all that there is to say, or at least cover a good amount of it. So I'm really excited to introduce our panelists in just a moment, but I'll walk you through just a little bit more about DPAC. Just really our mission is about you. It's about the diabetes community. Our job really is to make being an advocate easy. Because the government process is not. It's not very straightforward. There are opportunities to weigh in and to make an impact, but it's very hard as just a person living your daily life to know when that is and how to weigh in. And so we just like to be a giant easy button for people with diabetes and for this community. We are advocating daily on behalf of folks for access to care, medications, and devices for people living with diabetes. And we also work on not only educating and inspiring people with diabetes to be involved, but also for the lawmakers who are making decisions every day that are impacting the lives of people with diabetes. All right, so I'm going to introduce our speakers today. If you've got a question at any time, please feel free to use the Q&A feature, but I'll go ahead and get started with our panelists. So Donna Rice is the Chief Operating Officer of DiabetesSisters. Donna is a registered nurse and certified diabetes care and education specialist. She's a national and international thought leader, author of 4 books and numerous peer-reviewed and consumer publications. She's past president of the FADCES, the Association of Diabetes Care and Education Specialists, and has held numerous positions on state and national committees related to diabetes care, including the president of the Diabetes Health and Wellness Institute for Baylor Healthcare Systems in Dallas, Texas. Sorry, guys. I have a brand new baby, a 4-month-old at home. So you are hearing him right after his nap. So this is a live look at reality on the other end of the Zoom. But anyway, sorry, Donna, I was just wondering how you do all this. Donna has been a board member of DiabetesSisters since 2015 and has served as chair from 2018 to 2019. Karen is a member of our very own Diabetes Leadership Council board, and prior to joining DLC, Karen worked in corporate branding at several Fortune 500 companies. She retired from Abbott in 2015 after managing commercial operations for Abbott's animal health division. Karen currently works as a personal branding specialist and coach. She has lived with type 1 diabetes since 1984 and has served on the Wisconsin Affiliate Board of Directors and the ADA's National Board of Directors, chaired its National Strategic Marketing Committee, and served on multiple ADA committees and task forces. Thank you, ladies, for joining us. I know with those bios, it's amazing that you have the time to be here with us. So thank you so much for being here. And again, folks, as we're going through today, if you have any questions, please use the question and answer feature. Before we get started, because we may get some questions about this, just wanted to cover that there have been big changes announced in Medicare lately as the Inflation Reduction Act, the IRA, was passed. There are some things that are coming to fruition that were in that legislation. So you may be seeing that the IRA You may be seeing words like smoothing. So that's the shorthand for the provision that in the IRA, starting in 2025, it requires Part D plans to offer the option of allowing Medicare beneficiaries to spread their out-of-pocket costs. So again, starting in 2025, that option becomes available, and also starting in 2025, the out-of-pocket costs are capped at $2,000 a year. So what that means for beneficiaries is that $2,000 out-of-pocket expense that may happen in January, depending on your own situation, a person could pay $160-ish a month instead of $2,000 upfront. So these are some really positive changes. There's also been a list of 10 drugs that are subject to price negotiation under the Insulin Reduction Act, and CMS has released that list of 10 drugs that certainly has an impact on our community for diabetes, also heart failure, rheumatoid arthritis. There's several drugs on that list, again, and that takes place in 2026, but the negotiated prices are happening in the next year or so. So long story short, if you've got questions about that specifically, we will be covering that in a brown bag. DPAC is going to host a brown bag toward the end of the month on the 26th to answer some questions and just talk about what we know so far on these decisions. So please join us again for that, and we will send a link out and make that sign up available here probably by the end of the day, if not sooner. So that is coming. But today we're just going to talk a little bit more about what Donna and Karen know from their personal experience, and as well as their careers and backgrounds have given them. So thank you again, ladies, for joining us. And Donna, I want to start with you. So as a diabetes care and education specialist, can you give us some advice about Medicare coverage specifically for people with diabetes who are reaching that age of eligibility? How can they make the most of that experience with their care team? And I think you are muted.
Hey, thank you, Julie, for having me here. And I'm really excited to be here today. And I think, one thing I want to say is welcome to Medicare. This is a real exciting time in your life. And I think people need to feel blessed to have reached this part of their life. And I think when you think in terms about insurance, it's daunting, right? It's like if you change employers or you change jobs, there's a lot of choices. You have to pick which coverage would be best for you and your partner. So I think going on to Medicare is really, really no different from that. And I think you have to be proactive and you have to be prepared. So there's a lot of things that you need to start thinking about. And number one, I know people have asked me, can I remain with the same group of doctors? Are there providers for this plan? How do I know that if I change plans, I'll be able to stay with the same physicians? Does Medicare cover well visits, immunization, monitoring, and devices? Does it cover diabetes education? And then who underwrites the pharmacy benefit? And I think as a diabetes educator, this is a lot of questions that you get around the drugs, because they may have been covered under a certain tier in a plan, and then when they switch insurances, then all of a sudden it's not covered, or the out-of-pocket might be a little bit higher. So I think that there's always a lot of questions. So you really need to do your homework. What does Medicare mean? What does Medicare Advantage mean? Do I need a supplement? So I think that there's a lot of questions, co-pays, deductibles. So I think you need to make a list, you need to be proactive, and you need to be prepared. And what I've told a lot of individuals is it's difficult. Work with an agency or an insurance specialist to really help you, because you really need to look at what your coverage is today, what those special things that you need covering, like if you have diabetes, does it cover supplies? Does it cover CGM? What are you going to need for tomorrow? And I think these are all the things that you have to start mentally being prepared for, and then work with an agency or somebody who really knows the system really well. Oftentimes, your own healthcare team will have information. A lot of times, the healthcare systems that you belong to will send out a booklet about welcome to Medicare and some of the things that are offered through their plans if they belong to a plan. So I think you'll be bombarded with a lot of information. And I think just mentally preparing yourself, and then, excuse me, really looking for the resources and someone to help you through and to make sure that your questions are all getting answered. So open communication, really doing your homework and really being prepared and proactive. And I just want to make a point here. Working with people with diabetes for my entire career, I have to say that they are prepared and proactive around their disease. They know if they're traveling, what they need to bring. So I think this is just part of them. And I think part of the whole education process is saying, now that you're entering Medicare, you're changing insurances, there's some things that you're going to need to be prepared for. And I think it's just kind of a normal kind of situation and plan for them as well.
So making a list, being proactive, which, as you mentioned, is already just part of the DNA when you have diabetes, and making sure that you're prepared and seeking help, working, it sounds like, with your care team to discuss, and also maybe with an agency as well, to really understand to make sure that you're making the best decision for yourself based on specifically your medications. Great. And again, any questions, please feel free to submit them in the Q&A. I think that sets us up well, especially that it's a privilege to reach this phase, and it may be daunting, but there is help and there are answers. And so don't be overwhelmed, just be proactive. Karen, from your experience now, you've been living with type 1 diabetes for, I think, 39 years. Can you share some of the changes or differences between your previous experience with commercial insurance and more recently now with Medicare? And if you want to touch on, I'm sure there were hurdles that you faced or challenges that you faced, but please tell us what that transition has been like.
Sure. And first, I'm going to preface that I am having technical difficulty. So if there is a little bit of a lag, that's what's going on, but we're going to get through this. As Donna said, yeah, there are many choices, as with commercial. But what I did find is there were many more choices than I expected with Medicare. So for me, one of the toughest things at first was just understanding the core types of coverage. With commercial, my employers would offer me a few plans to choose from, and that seemed difficult at the time. But with Medicare, you first have to make a big decision between Medicare Advantage, which everybody sees on TV all the time. We're inundated with those commercials, or a supplement type of plan. And then once you've made that decision, you can choose from hundreds of plans with varying benefits. And just to give people a little bit of sense, because so many people I talk to just don't seem to have a clue. They probably listen to what a friend has gotten and they get that plan. But Medicare Advantage typically has a very low or no premium, and usually a lot of extra benefits and drug coverage. A supplement costs more, plus you have to buy a separate drug plan, but it covers that 20% that you're normally responsible with plans. And for those of us with diabetes who are at risk for complications, it's really important to carefully weigh this. And as Donna mentioned, have a great agent. That made all the difference. And I didn't realize that at the beginning. Oh, that person has access to databases where they can plug in the drug names and quickly tell you your bundled amount. So much easier. Yet most people I know are not working with an agent. A key thing to know that luckily I did find out is you can start with one and switch to the other. But if you start with Medicare Advantage, you only have 364 days to then switch to a supplement. In other words, it has to be done just before the year is up. Otherwise, after that year of grant time, you can risk being rejected for having the chronic condition or get a much higher premium. So what I did is I started with Medicare Advantage for the first 364 days so I could kind of see what that was like. And then I switched to the supplement, factoring in that, I could have complications later. Luckily, I don't have any now, but the other thing that I noticed with Medicare compared to my commercial insurance was that I felt there were more stringent requirements. I didn't go on a CGM until I started on Medicare, so I don't know the specifics under commercial. But some commercial plans don't even offer coverage for CGM. Luckily, Medicare does. The first thing that I encountered was that I have to see my endocrinologist within 6 months. It can't be a day later. And that can be difficult because my endo is jammed. Her schedule is so they're constantly trying to shuffle patients to see if they can make this happen. Luckily, and many people may not know this, I'm allowed to see the pharmacist on my endocrinologist team. Maybe not every, but that gives a good opportunity when my doctor is so jammed. So I encourage everybody who's listening that if they're entering into Medicare, to explore these options, think out of the box. The other thing that
So Karen, I think we lost you on audio for just a minute. And while you're
now
now we
you
got
never
you.
know. You never know what's going to happen with shipping. So less than 10 days to me is cutting it close. I'm sorry, Julie, it sounded like you were saying something.
No worries. I was just rephrasing. We lost you on audio there for a second, so I was just rephrasing. We heard most of it, but basically you're saying, you've got to get into your doctor every 6 months, and these are some of the more stringent requirements in order to maintain your CGM access. So the doctor's reshuffling, you were saying, and then you were also saying you can see a pharmacist not every visit, but that's a good option for folks who maybe are struggling to get into their doctor's office. And then I think you were speaking to reordering your CGM supplies and having to wait until that 10-day margin of error where that's all you've got left. And so that is obviously cutting it close, but that you keep that on the forefront of your priorities in terms of how you're spending your time at the end of the month.
Yes, I do. Now, having said that, Medicare does have some big advantages, including like the $35 cap on insulin. That's absolutely huge. And in 2025, the Inflation Reduction Act gives those with Medicare drug coverage the option to make monthly payments for those out-of-pocket costs that we have at the beginning of the year when we're trying to meet our deductible and spread them out more over the year. I don't believe any commercial plans have anything like that because commercial tends to follow suit after Medicare.
That's a great point. And we made it at the start, but in case you missed it, Karen's again speaking to that smoothing that's going to affect in 2025, where you don't feel the burn of that immediate, out-of-pocket cost up front and can spread those payments out, which is definitely an advantage. Karen, we've got a question for you that says, can you see a nurse practitioner within 6 months or just a pharmacist?
You know what? That is a great question. And I don't know that answer because my doctor doesn't have a nurse practitioner on her team, but I will find that out. And how can we make the answer available?
Yeah, I'll take the name down. And then that way we can make sure that you guys are connected after this discussion.
Great question.
Yeah. And if other folks have that question too, we can also send it out. Yes, but every possible workaround, I'm sure, is on the table when it comes to getting into your doctor's office. So switching topics a little bit here, we all know that, and we've got actually somebody from the audience offered an answer, said, yes, you can see a nurse practitioner. I've never seen my endo. So it seems like some folks just always go straight to the nurse practitioner. So we will check that box on the answer. And that makes sense. So we all know that living with diabetes is an entire spectrum of care. You've got prevention, delay, diagnosis, management, complications. So Donna, we're thinking long-term here. As a provider, what would you recommend patients focus on most for their long-term health?
Sure. So for long-term health, I think you really need to focus on self-management strategies and prevention, right? Preventable care. So Medicare covers various preventative services like influenza. It's flu season now. We need to get our flu shots, COVID testing, COVID screening, pneumonia vaccines, hepatitis B. We also have to look at routine screenings for cancer. I mean, we're all getting older and there's definitely, illness does happen. So looking at any kind of those screenings, your mammogram, colorectal screening, you know, prostate cancer screening, all of it. Also, eye disease is really important. Eye disease can be a complication of uncontrolled diabetes, and I think routine eye care and eye exams are important. Glaucoma screening, dental care, and a lot of these services are covered. Also thinking in terms of women and getting older, like osteoporosis, and it can occur at any age. So bone density measurements, I think, are also critical. We also have to look at, and really most important, if you have diabetes, it's diabetes self-management, education, and training. And I think this is a covered benefit for Medicare, right? And many people haven't had the opportunity to work with a diabetes care and education specialist. I mean, they need to realize kind of, is their diabetes self-management, you know, up to snuff? Is there new things that have come out that can really help them manage their diabetes? What will they need in the future? And I think that there's a lot of questions that if you work with a diabetes care and education specialist, they could really help you smooth out your diabetes management and really look to some of the things that you need. You might be a great candidate for continuous glucose monitoring, or maybe a smart pen. There's new technologies out there that could really help you get better control. So I think that there's a lot of things that you really need to look at today and then really start preparing long term. And then on that note, you know, you got to think, you know, sometimes health can change on a dime, right? And as we age, we need to really look at like maybe other services, home and community-based services that we might need as we get older, and start thinking and planning along those lines as well.
That's great. And we had a question come up. Thank you for bringing up the CGM. What do you think are some of the biggest challenges facing Medicare and Medicaid dual eligibles, especially when it comes to their access to CGMs? I don't know if either one of you can share perspective on that.
Well, I think just saying that it is a benefit. I think there's some criteria, and I think they should really work with their healthcare provider to make sure that they have access to some of these new therapies and treatments and aids that could really help them improve their glucose control. So I think every case is a little bit individual, but we do know that Medicare is covering CGM, and there are some criteria underneath that I think probably someone could speak better to, but I do think that's where the communication piece comes in, and where you have to be proactive and say, you know, I heard about this, maybe it was through my diabetes self-management training class or whatever. Am I a candidate for this, and how do I go about getting this? So I think you have to be proactive on all levels, not only in finding the right insurance, but making sure that you have access to the latest and the greatest when it comes to diabetes technology, diabetes education and care, and also other services.
Yeah, that's great. Thank you. Donna, you know, we're on the subject sort of technology and just how the landscape has changed over the time that you have had diabetes. And so I'd love to hear your thoughts. And since we're talking about access to technology too, just as well, give a shout out. DLC and DPAC have worked really hard on coverage criteria. And so really glad to hear that's kind of where the conversation's headed.
Yeah, and as a diabetes care and education specialist, we certainly want to thank you for really, you know, heading that up and really making those changes with Medicare and on all fronts for people with diabetes. But, you know, technology's really played a huge difference in enabling people to get better control. And I think it really needs to be embraced and engaged, and people need to know what's out there. I mean, there's so many new things. There's smart pens, there's different ways to deliver insulin, different ways to monitor your blood glucose. There's different therapies out there now that could really help, different injectables that aren't insulin. So I think there's just so many things out there that you need to kind of really work with your healthcare team, making sure that you have the best education and that you're really abreast of and up to date on really what's out there. It's changing fast. A lot of new things are coming out, and I think as consumers of healthcare, we need to know what these are and embrace them and go after them if we think that they would help us.
I want to add to that, as Donna's pointed out, all this wonderful technology. We're both living proof that people can successfully live with this disease. We have a much greater chance than so many other diseases because we have all these great tools. When I was diagnosed 40 years ago, I felt my life was over. All the information said I was probably going to get one of these complications. And now I don't really think about it much because I have a CGM, which has made a huge difference in my control. I'm in the non-diabetic range. So yeah, the technology has been fabulous, and we should just keep working toward better access for everyone. I wish every single person with diabetes could have a CGM.
Yeah, and Karen, thanks. That's awesome, and I'm glad that you're well controlled. And I just want to point out here that I don't have diabetes. I'm a diabetes care and education specialist, and I've worked with individuals with diabetes for the majority of my career. So I just wanted to make sure that that was really clear.
Yes, I might have been asking a question when I mentioned it. And yes, thank you for distilling that, Donna. And Karen, thanks for the perspective. You know, again, just how this landscape changes and evolves, and you staying on top of it. Totally agree. We all people with diabetes, one is just affordable access to the tools that they need to manage this disease. So for you to have had access and to have had success, and again, to have been so proactive, as Donna continues to mention, is key to this whole equation, is really, really fabulous. So thank you for sharing that. You know, if there's anything else you would like to share on the technology or on, you know, your experience in general, we'd love to hear that. And any other advice, Karen, that you would have for someone living with diabetes and aging into Medicare?
Well, just to quickly piggyback off of what Donna said about being proactive, I would suggest that somebody starts researching the Medicare at least 6 months out. You know, don't think you can do this within a week and then you're going to enroll. So make sure to take the time. The only other factor I'd throw in there is, I don't know what most people's propensity for travel is, but my husband and I like to travel outside the United States. And it was interesting because I found the Medicare Advantage plan I was looking at had better coverage than the supplement, but I didn't allow the travel coverage to be the deciding factor. I decided to check into travel insurance, where you can also get health coverage as a component. So I encourage people to think out of the box, look at other options before they make their final decision.
Thank you. That was actually a question that we had was, did Karen end up staying with the Advantage plan, or did she go regular Medicare plus supplement, and how, a little bit more behind unpacking that decision for you. So thanks for the additional context there. I want to make sure too that we get to all of as many questions as possible, and we've got some folks asking one about the donut hole. My patient was on a GLP-1 but can no longer afford it. I was told that Novo may be able to help with their patient access program if the patient is denied extra help through SSA. Is there any other route to get her help paying for this medication? And I think actually we had another person in the chat weigh in say the problem is having your third-party supplier able to satisfy Medicare rules, specifically having your A1C done, and your doctor note the fact that they are following you and that you're being managed. But I wanted to let either Donna or Karen weigh in just on that conversation around just that challenge.
I really can't weigh in a lot, except I think that that's the conversation that you have with your healthcare provider. So if there's not a pharmacy or a drug assistance program that you could get in, and if you really can't afford it, what's the alternative for you? And I think that that's the conversation.
And any perspective on the cost associated with having an agent or somebody who helps you choose a Medicare plan? Don, I think Karen, maybe based on your expertise.
Right. There was absolutely no cost. I did it for my aunt, for my husband, and myself. And and that person was available all the time. I could email. So yeah, no cost. Definitely get an agent.
Awesome.
And then through healthcare systems, sometimes they have people that are the experts in insurance, and they'll help you too. If you have questions about coverage in the future, they'll help you. Like I said, I remember at Baylor, there was a booklet that came, Your Guide to Medicare, and here's a hotline to ask questions. So I think that there's a lot of resources. I do think some insurance agencies do charge. It's not a lot of money, but they do charge. I know the one that I spoke with was like $150, and that was, for the year, and any services I need for like a year. So essentially it wasn't that expensive, but it was well worth it because there was a lot of confusion. especially around the pharmacy benefit. And if you need a specific drug, what tier is it covered on? And I think that becomes a little bit daunting and confusing. So having somebody help you, like Karen said, somebody kind of went through all her medications and really helped to see what pharmacy benefit and what plan would work the best for her. So I think all those things you just need to take in consideration. And I just think you need help doing it, and ask for help and ask as many questions and be prepared.
For sure. And we've gotten a lot of great questions throughout today's event. I'm just going to throw out the Diabetes PAC, the Diabetes Patient Advocacy Coalition email address, which is info@diabetespac.org. Again, that's info@diabetespac.org. We would love to continue the conversation for those who have more questions around this. I'm going to pick one of the many that we've gotten, and just one was about how can we advocate for better coverage of pen devices, et cetera, and really speaking to the technology as technology continues to come on board. Of course, I have a perspective, but I wanted to open that up to Karen and Donna as well.
Well, I'll just make the plug for the diabetes, the DPAC, because I encourage everybody to become an advocate with DPAC, because while DPAC and DLC are both working to work with legislators, and we're doing a session in October, we need the Army. We need people in the field that can locally connect with their representatives, their congressmen. So to me, that's the #1 way.
And I have to agree. And I was going to jump in and say that your voice has to be heard, and to really find those advocacy groups to really help carry that voice through. And I think Karen, what you mentioned is really critical, and just thanking DPAC for all their work and DLC for all their work, and really helping individuals kind of like get the coverage that they need and deserve.
Yeah, I think that's a great note to end on, because there's so much more work to be done. We are encouraged by several of the changes that are going to be taking place in 2025. A lot of times we have advocates join, and this is obviously a Medicare focused brown bag, but who are not yet eligible for Medicare. And they want to understand a little bit more about why so much of what DPAC and DLC do has to do with Medicare, because that's really the government's purview. And as Karen mentioned, a lot of times commercial follows suit with what changes are made in Medicare. So we work Medicare, Medicaid, states, all 50 states and Congress, to try to ensure, again, that as technology continues to come to market, some of it just has to do with explaining sometimes very basic things about diabetes, that it is a self-managed disease, for instance, is news to some folks who are lawmakers, and really what is needed, that it's not just insulin, right? We've had a lot of conversation about the technology around managing diabetes and things that are coming to market or even new on the market, or existing for a while, and there are still barriers. So that's a lot of what DPAC does, is empower advocates. As Donna said, everyone's voice is really important in this conversation. And that's how lawmakers are making their decisions, is by hearing from their own constituents about what's most important. So we try to give as many opportunities as possible to do that, particularly within states. We're really effective. And then also with Congress, it just, can take a while. So please join us to that end on our brown bag at the end of the month, that's going to talk more about some of the changes that are taking place, and just how we're involved as organizations. But also wanted to give a quick plug for our upcoming Hill Days, which, again, as you're looking for options and ways to weigh in, technology coverage is certainly part of our agenda for what we are asking Congress this year. We have Hill Days every year, sometimes multiple times a year, but ours is upcoming in October. You can see here on the screen, the 25th and 26th. So you can use the QR code and sign up. You can also just go to our website, diabetespac.org, and find out more there. But we would love to have you join and sign up for that. It's a great opportunity to meet with your member of Congress and or their staff, and have a conversation, really just informing them about the things that matter to you and to us as part of this community. So thank you so much to everyone for joining. Thank you to our panelists. Again, please feel free to email us if we did not get to your questions, and we would love to respond to those and continue this conversation. But thanks so much, Donna and Karen, for your time, and we will see you soon.
Thanks. Bye-bye.
Thanks, everybody.